Welcome back to CTV Morning Live, our Healthy Living segment with Steve Brown, our president of Family Physiotherapy. Always great to have him here. And it's always great. He brings new information, a lot of different physiotherapists and what they're working on. Anne Prendergast is joining us. She's a physiotherapist with him as well. Westgate location, is that
yes,
right?
Yes.
And then Sheila is back. We understand she was here 2 years ago, and we're kind of getting through some of the information. So for you to be able to have Anne at the Westgate location, this is huge because there's only, what, 10 therapists that are working with this.
That's right. Intermuscular stimulation is an advanced form of acupuncture, and Anne is our advanced acupuncture physiotherapist.
So what is the difference then between what people would consider acupuncture and IMS?
Well, the way that IMS works is to release tightened, shortened muscles. The reason that the muscles are shortened and tightened is generally because of wear and tear, which can happen in the spine. So when there's wear and tear, extra bone is produced around the joint, and this is very close to the nerve. So what it does is it irritates the nerve and causes the nerve to cause the muscles to shorten and tighten. So this, so basically with IMS, we're releasing shortened, tightened muscles, so we're getting right to the root of the problem. Acupuncture is also very effective in the treatment of spinal or peripheral conditions, but acupuncture works differently. With IMS, we're getting to the root of the problem, which is the shortened muscle. With acupuncture, we're leaving the needle in, and that causes the body to produce endorphins, which are natural painkillers. Along with the endorphins is produced cortisol, which is a naturally occurring cortisone. So you get the anti-inflammatory effect.
Okay, so when you would be working on the muscle, it's different than actually having acupuncture. It would stay in, right?
That's correct.
So
yes.
That's not what's going to happen right now.
No.
Okay.
No. What I'm going to do is I'm going to find a tight muscle in Sheila's shoulder, and I'm going to tap the needle in. And so what you may not see this happen, but what will actually happen if the muscle needs the treatment is it's going to grab the needle. The muscle will grab the needle just for an instant. I think Sheila felt it there, and I felt a little twitch. And so what happens is I then take the needle out, this muscle is released, or this muscle band is released, and then I will move to another muscle. Whereas with acupuncture, I would be leaving the needle in.
So is this, for the patient then, who's
yes.
going to be going through, what does this feel like? If it, there's something serene about kind of the acupuncture, that there's a sensation with this.
Yeah, with this, you actually feel, if the muscle, like I said, if the muscle needs the treatment, it's going to grab the needle. So the patient will feel a sort of Charlie horse sensation, but just for an instant. And then once the muscle lets go and I remove the needle, then the patient gets a feeling of well-being. So
how many would you do then in one location?
It would all depend. If Sheila had, for example, a tennis elbow, because very often these tight muscles can pull on the tendons and cause tendinitis to occur, then I would be working not only at the neck, but I would be working down the arm and right down to her elbow. So it all depends on what I find. I do an assessment, of course, and I may do, perhaps 10 IMS points in a session.
So okay.
It would all depend on what I found.
Depending on how tight you are, you could be in there for a couple more Charlie horses. Pretty much. So another spot. So would you stay in the vicinity? Or would you then move, how much further up would you go?
I would be moving, I would also move up to the neck. If Sheila was lying down, I would be able to do some points up in her neck, if that was appropriate, if I found tight muscles in that area. And this is where the nerve comes out. So by releasing the muscles in the neck, as I said, it's actually getting to the root of the problem. And then I might move down to the arm, for example, if she was complaining of tennis elbow pain. And very often this can be effective in patients that have tried other types of treatment, which are excellent. Ultrasound and various other types of treatment are excellent for tennis elbow. But this gets right to the root. Maybe they need more.
Which would be something, with so many physiotherapists working, that you understand certain things are happening, and so you have, of course, the options to say, okay, this isn't quite getting the spot, let's try something else.
That's right. We'll send them over to Anne to try the IMS on them.
Perfect. Good summer?
Yes.
Thank you so much for this information. So keep in mind when you're asking the questions, the difference between acupuncture and IMS, and then there's about 10 advanced people who have this qualification right here in our city, and being one of them. Thanks so much, guys. Sheila, hope you're okay. Move. Yeah, okay. We're going to take a commercial break. We still have plenty more to come here on CTV Morning Live.